This is the recording of a workshop held on January 31st, 2021, on the topic of systemic racism in health and housing. It is the third in a four-part series on racism and systemic bias presented by the Interfaith Communities for Dialogue. The panelists for this program are 𝐏𝐫𝐶𝐬𝐶 Benjamin, MD, Executive Director of the American Public Health Association, and Michelle Krocker, Executive Director of the Northern Virginia Affordable Housing Alliance. We open as the program is being introduced by ICD Chair 𝐏𝐫𝐶𝐬𝐶𝐬𝐶.
We're extremely fortunate to have some of the original founders of ICD still working with us and on our steering committee. And I wanted to mention a couple. Murray Monson is our chair emeritus and current vice chair. And Geneva Pope and Fatima Popal are also still working with us and in various capacities, and they remain active. So we are extremely fortunate to have their continuing service. There are others, Eric and others who have been associated, Mogita is there. So many of us have been benefiting from their experience and advice. On the slide, you'll also see ICD's mission. On top of the right, on the right corner, ICD is a faith-based and an organization with associated organizations as well who are related to various communities. Its main purpose is to promote mutual understanding and positive relationships among a very diverse people in our Fairfax County. We're active in three areas: interfaith education, engagement, and community building. We are currently updating our strategic plan, and we're essentially responding to the changes in our larger community as well. Now, a couple of words on why we are focusing on racism at this time. As you can see from the slide, it's consistent with our larger mission. We promote inclusiveness, integrity, mutual respect, and trust of all people. And we stand in unity and support when any member of our community is targeted by disparaging words or actions. We believe strongly that people of all faiths must bear witness and oppose the racial inequality and brutality facing the people of color in this country particularly. ICD has recently issued a formal statement to this effect. It's a joint statement from all the 10 organizational members. And that statement was also approved individually by each of the boards or leadership of the member organizations. So we are essentially focusing on our mission, and for the last few months, picking up an issue that is of current importance in the community and in the country at large. As I said before, this is the third workshop. We've had two before this, and they covered education, police, and judicial systems. And today we'll be covering health and housing. Before we introduce the speakers, we'd like to share with you a short video on just the concept of systemic racism. So I'll stop here and we'll show you a 4-minute video. So I think we're going to show the video now. The rest of us will be muted. Thanks very much. Welcome again.
This is Jamal. Jamal is a boy who lives in a poor neighborhood. He has a friend named Kevin who lives in a wealthy neighborhood. All of Jamal's neighbors are African American, and all of Kevin's neighbors are white. Because Jamal's school district is mostly funded by property taxes, his school is not very well funded. His classrooms are overcrowded, his teachers are underpaid, and he doesn't have access to high-quality tutors or extracurricular activities. Kevin's school district is also funded by property taxes, so his school is very well funded. His classrooms are never crowded, his teachers are very well paid, and he has access to high-quality tutors and lots of extracurricular activities. Kevin and Jamal live only a few streets away from each other. So how come they're growing up in such different worlds with such different opportunities for success? The answer has to do with America's history of systemic racism. To understand it better, let's look at what life was like for Kevin and Jamal's grandparents. Decades after the Civil War, many government agencies started to draw maps dividing cities into sections that were either desirable or undesirable for investment. This practice was called redlining, and it usually blocked off entire black neighborhoods from access to private and public investment. Banks and insurance companies used these maps for decades to deny black people loans and other services based purely on race. Historically speaking, owning a home and getting a college education is the easiest way for an American family to build wealth. But when Jamal's grandparents wanted to buy a house, the banks refused because they lived in a neighborhood that was redlined. So Jamal's grandparents were not able to buy a home, and because colleges could prevent them from attending through legal segregation, their options for higher education were really scarce. Kevin's grandparents, on the other hand, got a low-interest loan to buy their first house and got accepted into a handful of top universities, which traditionally only accepted white students. This opened up a wealth of opportunities that they were able to pass on to their kids and grandkids. Even as late as the 1980s, an investigation into the Atlanta real estate market showed that banks were more willing to lend to low-income white families than to middle or upper-income African-American families. As a result, today, for every $100 of wealth held by a white family, black families have $5.04. A 2017 study confirms that redlining is still affecting home values in major cities like Chicago today. This explains how Kevin and Jamal inherited vastly different circumstances. Unfortunately, the story doesn't end there. A big part of systemic racism is implicit bias. These are prejudices in society that people are not aware that they have. Let's go back to Kevin and Jamal. Against all odds, Jamal manages to be the only student from his high school to get accepted into a great university, the same one that Kevin and his high school friends are attending. But after Kevin and Jamal both graduate, Jamal notices that his resume isn't drawing as much interest as Kevin's, even though they graduated from the same program with the exact same GPA. Unfortunately for Jamal, studies show that resumes with white-sounding names get twice as many callbacks as identical resumes with black-sounding names. Implicit bias is one of the reasons why the black unemployment rate is twice the rate of white unemployment, even among college graduates today. You can see evidence of systemic racism in every area of life. The disparities in family wealth, incarceration rates, political representation, and education are all examples of systemic racism. Unfortunately, the biggest challenge with systemic racism is that there's no single person or entity responsible for it, which makes it very hard to solve. So what can you do? The first thing you can do is work towards becoming more aware of your own implicit biases. What are some prejudices that you might hold that you're not aware of? Second, let's acknowledge that the consequences of slavery and Jim Crow laws are still affecting access to opportunity today. As a result, we should support systemic changes that create more equal opportunities for everyone. Increasing public school funding and making it independent from property taxes would be a great start, so that poor and wealthy districts can receive equal access to resources. Systemic problems require systemic solutions. Luckily, we're all part of the system, which means that we all have a role to play in making it better. Peace.
Okay, that was just a starting video. We'll have a lot more discussion today. I won't take any more of your time. I want to introduce the facilitator. That's 𝐏𝐫𝐲𝐶 from ICD's steering committee, and she also is the outreach deputy director for 𝗣𝗲𝗶𝗀𝗀 Islamic Center. She has focused on racism and justice and community engagement for many years. She's a lawyer by training who studied in Canada and the US. And we've been fortunate to have her as the facilitator for the last 3 workshops, today and the previous 2. And along with her, we have Judith Shamir from 𝐿𝐴𝐴𝐴, who is also co-facilitating. You'll hear her later on. So thanks to both of them for getting us started, and they will introduce the panelists and explain the ground rules. So thanks very much for joining us, and we'll continue to have conversations for the next couple of hours. Welcome again. 𝐏𝐫𝐲𝐶, it's yours now.
Welcome, everyone. I hope you can all hear me. Thank you for coming out on this Sunday afternoon. We've survived January 6th, and we're glad to be here discussing this topic of systemic racism. To start with, we had 3 panelists, and Jeremy was one of our panelists among the 3, Jeremy Clayton. Just received, as I was getting ready to jump on, a message from him that he is available to jump on for any questions at this time. So I was going to announce that he's not available. A friend of his passed away and he was away, and he might be available for questions. Now, Jeremy, well, I'll just read a little bit about him when that time comes, but for right now, we are just going to discuss the housing and health issues with the other panelists. And if we have time, Jeremy could add, because he's more of a local affiliate. And then some instructions on what's going to happen today for everyone is that there is 3 or 4 sessions on understanding racism that's already been done, and today's the 3rd one. So now panelist presentations, panel discussion, I will be moderating with just the 2 speakers and maybe Jeremy. We'll see how that works out. Breakout session, the participants will meet in a small breakout room to experience insights about how inequities in housing are impacting you. And each group will have a prearranged facilitator who will designate someone in the group to act as a reporter. So don't forget to assign a reporter in your group. And then the panelists will respond to these reports as well as your written comments or questions. You can submit your questions at any time to the host, Judith, and we'll do our best to respond to all of them in this segment of the program. And then there will be concluding remarks by each panelist. And just some housekeeping. All microphones should be kept on mute to avoid any disruption. And this workshop is being recorded. So just so you know, and it will be shared on our YouTube channel. Now, at this point, I'd like to introduce the panelists. Michelle Krocker is an executive director of Northern Virginia Affordable Housing Alliance, and she's a public policy and community development consultant assisting private sector organizations and local governments in creating diverse, affordable communities through effective housing and land use policies. That's a mouthful. She is the founding member and executive director of Northern Virginia Affordable Housing Alliance and regional advocacy coalition engaged in expanding the base of political will for the adequate public resources to address the unmet housing needs of Northern Virginia's low and moderate income households. Prior to joining the Alliance, Michelle was Director of Housing and Community Development for Cornerstones, formerly Ruston Interfaith, a human services agency serving low-income families in northwestern Fairfax County. In that capacity, she led the department in the acquisition of financing and rehabilitation of scattered site rental housing for households served by the agency. Michelle has served on multiple citizen advisory boards. She was a member of the Tyson's Land Use Task Force from 2005 to 2010, charged with planning the redevelopment of 1,700 acres of Tyson's Corner, and the chair of its Affordable Housing Subcommittee. She also served on Housing Advisory Board to the Loudoun County Board of Supervisors, acting as chairman for 2 years. Current advisory boards include BB&T and Community Development Advisory Committee, the Housing Leaders Group of Greater Washington, the Fairfax County Affordable Housing Advisory Committee, the Alexandria Affordable Housing Advisory Committee, and the Board of Directors of Housing Virginia, a statewide housing education, advocacy, and policy organization. Wow. And our other panelist is Georges Benjamin from Maryland, Executive Director of American Public Health Association, APA. Georges Benjamin is known as one of the nation's most influential physician leaders because he speaks passionately and eloquently about the health issues having the most impact on our nation today. And that's going to become very relevant as we continue this program. From his firsthand experience as a physician, he knows what happens when preventative care is not available and when the healthy choice is not the easy choice. As executive director of APA since 2002, he is leading the association's push to make America the healthiest nation in one generation. Well, I think he's going to need our help. He came to APA from his position as Secretary of the Maryland Department of Health and Mental Hygiene. Dr. Benjamin became Secretary of Health in Maryland in April of 1999, following 4 years as its Deputy Secretary for Public Health Services. As Secretary, he oversaw the expansion and improvement of the state's Medicaid program. And Dr. Benjamin is a member of the National Academy of Medicine, formerly the Institute of Medicine of the National Academies of Science, Engineering, and Medicine, and also serves on the boards for many organizations, including Research America and the Reagan-Udall Foundation. In 2008, 2014, and 2016, he was named as one of the top 25 minority executives in the Healthcare and Modern Healthcare magazine. In addition to being voted among the 100 most influential people in healthcare from 2007 to 2017. I'm excited to be here, part of this. And if we have time for Jeremy, at that time, I will share some items about Jeremy as well. So Michelle, you're up.
Okay, do you have my slides? Thank you very much. Good afternoon, everyone. I am Michelle Krocker. I'm the Executive Director of the Northern Virginia Affordable Housing Alliance, and I am so pleased to be part of this conversation with the Interfaith Communities for Dialogue on the important topic of housing, health, and racism. So I'm excited about the discussion this afternoon. Next slide, please. Just wanted to share a little bit of information about my organization. The Northern Virginia Affordable Housing Alliance is a housing advocacy organization working across multiple Northern Virginia jurisdictions. Our mission is to promote healthy, sustainable, and equitable communities that meet the diverse housing needs of Northern Virginia residents. Our activities include housing research, public education, and community engagement to support policies and financial resources for both the production and preservation of affordable housing. Our mission includes a sustained commitment to addressing racial inequities and meeting the housing needs of low and moderate income households. Next slide, please. This evening, I've been asked to speak about housing and racism. It's an important topic and one that encompasses several decades of American history and could be the curriculum for an entire semester of study. The stories are disturbing and heart-wrenching, but it's part of our history that we must know, examine, and understand if we hope to build just and inclusive communities. We know that shared community values such as safe, affordable housing in neighborhoods with access to healthcare and nutritious foods, places for recreation, quality educational systems, and employment opportunities for all are interdependent. At the Alliance, we believe that housing is the platform upon which families and individuals gain stability and thrive. So in the time that we have here, I wanted to provide highlights of how racism is embedded in our laws, policies, and practices that have shaped our land use for the past 100 years. I'll discuss redlining, which was mentioned in the excellent video that was shown, one of the most visible and egregious practices in our country, and how the legacy of redlining is still manifested today in our land use and zoning policies. I'll also list some of the steps that Fairfax County is taking to combat racist housing policies and what you as residents of the county can do to create more inclusive communities that provide housing opportunities for all of the diverse communities who call Fairfax County home. So these concepts that are listed on this slide here are concepts that I'm sure you have all encountered in the previous discussions that you've had, but they frame much of our national conversation about racism. So while they are familiar to most of you, I thought that they would be worth reiterating for our discussion tonight. So systemic racism, these are the policies and practices within and across institutions that intentionally or not produce outcomes that chronically favor or put a racial group at a disadvantage. Racial equity, what would constitute a genuinely non-racist society, would be the distribution of benefits or burdens that are not skewed by the color of a person's skin. And this last definition, white privilege, addresses whites' historical and contemporary advantages in access to quality education, decent jobs and livable wages, homeownership, retirement benefits, and wealth accumulation. I thought this quote from 𝐏𝐫𝐞𝐬𝐞𝐧𝐭𝐞𝐝 at the Wesley College Center for the Study of Women was applicable to so many of us who haven't truly internalized the concept of white privilege. Ms. McIntosh says, white privilege is an invisible package of unearned assets, which I can count on cashing in every day, but about which I was meant to remain oblivious. Next slide, please. Some of you may be familiar with the book, The Color of Law by Richard Rothstein. It was really a revelatory book for many, including myself, when it was published 4 years ago. Mr. Rothstein begins his story in the 1930s, focused on how cities accommodated the housing needs of a growing workforce of people migrating from rural to urban areas. The tools of zoning to designate and separate uses such as residential from industrial and manufacturing areas grew. Zoning was also used to segregate people considered undesirable from white people and white neighborhoods. To read this book is to understand, as this quote says, that today's residential segregation in the North, South, Midwest, and West is not the unintended consequence of individual choices and of otherwise well-meaning law or regulation, but of unhidden public policy that explicitly segregated every metropolitan area in the United States. These land tools were reinforced by financial institutions who underwrote and insured residential development, and even supported by some Supreme Court decisions. As was mentioned, the most egregious of these tools was redlining. Next slide, please. Redlining maps created after the Great Depression by the Homeowners Loan Association, which was the predecessor to the FHA, were produced for both urban areas large and small. This map on the screen is of the greater Norfolk, Virginia Beach area. The federal government released these maps between the late 1930s and early 1940s to designate safe investment areas for banks and mortgage lenders. Most white neighborhoods were marked in green and blue, indicating a safe place to lend money and build new homes. Black neighborhoods were marked in red, indicating a dangerous investment. I wanted to share with you some of the typical descriptions of each of these color designated categories, and the commentary that I will read to you are from documents from the Washington metropolitan area in the 1930s and 40s. So for the areas of green, which are the most quote unquote desirable areas, the description says, The property in residential subareas with this designation represents the highest grade of residential property in the Washington Metropolitan District. These areas are composed of newer high-class subdivisions, representing the best protection from adverse influences and occupied by the leaders of the community. They may be referred to as exclusive residential areas in that the price of properties limits their market to the class who desire and are capable of paying for the highest type of residential comforts. In general, these areas are considered to be the best residential and are occupied chiefly by persons in the highest income groups. They are made up of properties valued in excess of $15,000. This shows how old this document is. In good condition, with an average age not in excess of 10 years. The areas are not completely built up, and new houses conforming to the present type in the areas and appealing to the highest type of occupants are being constructed for the present market. They are well controlled and restricted by the developers, and their appeal should continue for many years to come. Now I wanted to read you a commentary for the areas that are marked in red, the red-lined neighborhoods. This area houses over 3/4 of the Negroes in the Metropolitan District and are showing effects of Negro occupancy. Many of the structures are in poor condition and are rapidly tending to become slums if they are not already in that category. There is little or no building activity in these areas as there is very little undeveloped land, though land value is usually high because of the expected expansion of the commercial areas. There's little chance of multifamily use as the neighborhood cannot be considered desirable for general residential purposes unless such activity were on a very large scale. There has been some attempt at building 4-family flats in these areas, but the people living there cannot pay enough rent to make this type of development profitable. As a result, activity has been very slow. And the commentary concludes with, the future of these areas is very questionable and certainly is not likely to be in new residential communities. These redlined areas were the neighborhoods in which Black residents were forced to live. They were considered undesirable. They were in locations adjacent to industrial and manufacturing areas of the city. And if these households wanted to secure a loan to make improvements in their homes, they were denied because of the location of their residences. Then in post-World War II, urban renewal programs created highways to the suburbs and destroyed thriving Black urban neighborhoods, replacing them with public housing. Next slide, please. The Fair Housing Act of 1968 was created during the era of other significant landmark anti-discrimination legislation like the Civil Rights and Voting Rights Act. The Fair Housing Act states that discrimination in sale, rental, and financing of dwellings based on race, color, religion, sex, or national origin is prohibited. And the act was updated in 1988 to include persons with disabilities and familial status. However, we know in communities across the country that there is still segregation and discrimination in both rental and ownership markets. Fairfax County has done what's called an analysis of impediments to fair housing choice, which is a requirement of jurisdictions as part of the implementation of the Fair Housing Act. And their last AI analysis of impediments was done in 2017. And they noted some of the following conditions that prohibit complete access to housing. One was the presence of a dual housing market, which offers different opportunities for Black residents than for white residents in providing selections for housing that is for sale. So in other words, Black residents were only shown houses for sale in very specific neighborhoods. They were not given access to the entire market of for sale properties, whereas white residents had access to the entire market of for sale properties. Another impediment to housing is the cost. The average single family home in Fairfax County costs over $630,000. And this cost makes home ownership out of reach for many, many low and moderate income households who are often people of color. So both the supply and the cost make attaining home ownership unaffordable for many. Another characteristic that was noted was that 95% of the real estate agents in Fairfax County were white, and that advertising and marketing for many new homes and communities only showed white residents, and it gave the impression of not being welcoming to people of color in the community. In addition, lenders and appraisers are also responsible for discriminatory practices. We know statistics have shown us that people of color are denied disproportionately higher, are denied their applications for mortgage loans much more than white people, or they are pushed into higher interest loans and predatory lending practices. We also know that for appraisals of homes by Black homeowners, these appraisals quite often come in lower than the appraisal for homes of white homeowners, even homes in mixed race or predominantly white neighborhoods. And there's been a lot of documentation recently, both in the New York Times and the Washington Post, about instances of mixed race couples who have received varying appraisals depending on whether it was the white spouse or the Black spouse who was showing the home to the appraiser. Next slide, please. So all of these factors have worked to have an impact on the ability of Black residents, people of color, to own homes and to build wealth. In 2016, and this is a national statistic, the net worth of a typical white family was $171,000, which was nearly 10 times greater than that of a Black family at $17,150. And certainly the story in the video that we saw indicates how the ability to build wealth is passed on to generations and the impact of that. So again, we saw how both access to employment through skills, training, and job advancement, access to higher education, the ability to purchase a home, all these are factors that have conspired against people of color to build wealth. Next slide, please. I wanted to share this map with you as an example of what is happening in Fairfax County today, or what our landscape is, if you will, around zoning and land use. So as you can see in this map, which was created by a report that our organization released last year on housing affordability and housing supply, Fairfax County is the large jurisdiction that dominates the map. The light green area indicates land that is zoned exclusively for single family detached housing. Actually, 82% of residential land in Fairfax County is zoned for single family detached housing. The red areas indicate land that is zoned for multifamily housing. So having only single-family detached housing with the cost of housing in the community, you can see that it becomes a barrier for people to access. It dominates our residential patterns. It maintains this legacy of segregation. It promotes exclusion. Another factor is the power of homeowners associations, which are majority white owners, and they exert enormous influence and control over land use decisions. And that excludes participation by minority and renter households who are not homeowners. So the result of this is the diversity of housing types that we would need to promote access to quality neighborhoods is prohibited. Next slide, please. There are resources in the county to address fair housing issues and to address better access for all people. One is the Office of Human Rights and Equity Programs, and they investigate any human rights and fair housing violations under the implementation of the Fair Housing Act. Also, I know that many of you, I'm sure, are familiar with the One Fairfax Pledge that was adopted by Fairfax County's Board of Supervisors in 2017. This is a commitment to equity and fairness in all government policies, practices, and procedures. Last year, the chairman also established a task force on equity and opportunity, and the recommendations for that task force in all areas of policies and practices should be coming out sometime this year. But actually more can be done. And I had mentioned homeowners associations and civic meetings. And this is a place where more of us can attend, can see what things are being discussed, speak up when proposals come forward to create new forms of housing, more affordable forms of housing in the community, share your support for this housing and your support to house all people, diverse peoples of all incomes and backgrounds in the county. There's another very critical group in the county that some of you may be aware of, and these are the land use committees that have been created for each magisterial district. And any development that would happen in that magisterial district would come to that supervisor and also to the land use committee. Many of the members of these land use committees have been members for decades, and there has been advocacy around the concern about the power that these groups wield, and also the control that they have over what is built in the community. So there is a real need to open these land use committee meetings up, both with greater participation by others who live in those districts and a stronger voice for those who are not at the table. Next slide, please. So this is really recommendations for how we promote more inclusive prosperity in our housing conversations. And it begins by developing an engagement process that includes stakeholders from both the public and the private sector to create a shared community vision for the future. We need to build grassroots advocacy and awareness, which is certainly something that you're doing this evening, to support Grasstop's leadership for change. We must be inclusive in our outreach, as I've mentioned, and enlist residents who usually don't participate in civic discourse: renters, minority households, immigrant families, young families, and single-person households. We need to use data to track changes in our demographics and population to show the growing diversity of our region and to celebrate that diversity and all that it brings to the region. And finally, we need to have courageous conversations about the legacy of systemic racism in our governmental policies and processes, such as those in our land use and zoning. Next slide, please. That concludes my presentation. Thank you for inviting me, and I look forward to the discussion.
And now we will hear from Dr. Georges Benjamin on health inequities. Thank you, Michelle.
Hi, everyone. Thank you, Michelle. That was absolutely an amazing presentation. Let me talk a little bit about the intersection between health and housing as well. And just to point out that there are really 4 big reasons why we see these inequities in health. And one of the things that we know is that in many communities of color, individuals of color have higher prevalences of disease, heart disease, lung disease, cancer, and higher morbidity and mortality. So they die, not only get these disease younger, but also die sooner. And one of these, of course, is differences in access to acute and chronic care. Health insurance is not the only reason. Certainly health insurance is one, but also simply being able to get into the doctor, having a primary care physician, less prevalence of that in communities of color. Some of you may know that under the Affordable Care Act, our nation expanded healthcare coverage for low-income individuals, but there are certain states, interestingly enough, states with higher prevalences of minority individuals, traditionally in the South, that did not expand health insurance coverage for their populations, particularly their low-income populations. The second one, of course, is differences in the quality of care received. We would like to think that all of our healthcare providers provide all their patients equal care. Turns out that's not true. And some of it is a lot of it's unconscious bias. A lot of it is perceptions of the care that folks should have. There is a very famous study that looked at the view of pain perception among Black patients versus white patients. And it turns out that many health providers, physicians, actually think that there are differences in pain perception, i.e. African-American patients don't require as much pain medication as white patients. And we've seen that, or what they assume is that those African-American patients are drug addicts and therefore don't deserve to have as much pain medication. We've also seen differences in where you take patients for care, or of the quality of care that's available in a particular community based on the quality of the health system in their community. Third is individual behavioral differences in approach to health or health care. Certainly, behavioral health is important, and how we seek health care is extremely important. Family views, individual views on what care is appropriate. The fact that if English is not your first language, just getting that information is often a challenge for folks, as well as, you know, if you were treated badly yesterday in a physician's office or a healthcare provider's office, you're less likely to go back, even if you're not feeling well, because of the way you were treated. And then the fourth one, of course, differences in social, political, economic, or environmental exposures, and that includes racism and other forms of discrimination. We call those the social determinants of health. And we saw a very, very clear presentation about what those social determinants of health could be. So what I'm gonna do is I'm gonna try to put this in the context of pointing out the fact that place matters. Your zip code absolutely matters. And it determines, as you solve the zoning discussion, access to a whole range of societal access, whether it is not just housing, but high quality schools or nutritious foods. We have communities in which you cannot buy nutritious foods. You have to get on a bus, maybe a couple buses, to actually get out of that community to get nutritious foods. When I was the health commissioner in Washington, D.C., I used to talk a lot about the fact that it was not a full service grocery store in Ward 7 or 8 in the District of Columbia. And it was only recently that a full service grocery store was put into a community east of the river in Washington, D.C.
Where we mentor people.
Issues around transportation and social cohesion, all of these kinds of things are very important in our communities.
You need to take me
To show you a little bit about the power of place. So this is a U.S. News Health ranking that comes out every year. And this is West Virginia. Now, this looking at 2 counties, which are 97% white. And this is Mason and Putnam counties. And there is a difference in the scores in these 2 counties of 20 different points. And in fact, higher incidence of mortality in one county than the other. And Mason County is the one that doesn't have is not as well off as Putnam County. And it's not that these 2 counties are fundamentally making different unhealthy choices per se, but Putnam County has better schools, a stronger economy, and spends more money on public safety. And so place is very important here, even though both of these counties are fundamentally white counties. This brings a little more closer to home. This is a map. I'm sure most of you would recognize these various routes as the Washington, D.C. metro system. And the numbers you see there are years in mortality. Now, in public health terms, a 1-year difference in mortality is a really, really big deal. It takes a lot of difference in health to get a 1-year difference in mortality. And yet you can see that the difference between the upper east side of Washington, D.C., and probably what we're talking about, Fairfax County, is almost an 8-year difference in life expectancy. That's a big difference. And it tells you a lot about the differences in capacity, in societal capacity in these various communities. And we've seen this all over the country. This type of map has been demonstrated for many, many communities where you see these huge differences in life expectancy based on where you live. So we've already talked a bit about the differences in race and racism, but let me just, for the purposes of a couple slides I'm going to show you, just to remind you that race is fundamentally a social construct based on physical characteristics and really doesn't have much of a genetic basis. That racism is fundamentally the false belief in the superiority of one group of people over another based on race. And what's important is that racism unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, as we just saw, but fundamentally it saps the strength of the whole society by wasting human resources. And I just remind folks, what would we have been like if Dr. Charles Drew, who of blood bank fame, had not discovered how we could utilize blood? We would have had real problems in the war in terms of providing healthcare for soldiers. Where would we be if those African-American women had not been around when we were trying to get our astronauts to the moon? So, you know, the challenge we have is the fact that these systems are integrated in our society today, and we're really struggling to figure out how to deal with them. The 3 components of racism, from structural racism, which you saw with redlining, with differential access to goods and services and opportunities by race, personally mediated racism, which is the most common thing that people think about, with the prejudice and discrimination based on assumptions about one's capability, motives, and intent. And then, of course, internalized racism. We don't talk a lot about that, but that's the acceptance of the stigmatized races of negative messages about one's own abilities and intrinsic worth. We often talk about this as the white man's ice is colder syndrome, where folks actually believe that they're not capable or inferior because they've been told over and over and over again that they're not capable of doing something. And then they begin to believe it and begin to behave that way. So I'm going to talk a little bit about how this played out very early on in the COVID outbreak a year ago. So we had issues around testing, around availability of testing, which was unequal in many communities. And a lot of it had to do with we located in the test facilities. So think about what we did. And I thought those drive-through testing facilities were absolutely marvelous as well, but they were most commonly not in communities that were easy to get to. They were not in communities of color. Early on, we told people, you had to go get tested. And if you didn't feel well and you didn't own a car, or you lived in a community where you had to take a couple buses or a train to get there, and you weren't feeling well, you are less likely to go and get tested. And certainly if you weren't feeling well, you weren't going to get into a long line. So for people who were disproportionately impacted because they were not well, and minorities were disproportionately impacted, they were less likely to get tested because of where we actually placed the testing facilities in many cases. The messaging for those tests were that you needed a gateway provider initially. Go to your doctor. So if you didn't have health insurance coverage, or if you didn't have a relationship with the primary care provider, assuming that provider could give you the test, that was a disadvantage. And while the federal government certainly paid for the cost of testing, you often had to get there. So even if you could get on the bus and get there, you had to have the resources to get to the testing facility. And quite commonly, even though the testing was free, actually paying the doctor's fee. So you usually go to your doctor, often would not just go for a test, but you went to the doctor because you weren't feeling well. And while the doctor was there, they tested you for COVID. So you often had to pay the clinical visit. That often required a copayment or a deductible for that visit. So it wasn't free completely, even though the test itself may have initially been free. And all of these things resulted in disparities early on in the testing for COVID. This whole issue of personally mediated racism, the challenge of masking while Black, there's several high profile situations, one in a very well-known store in Illinois, where two African-American men were filmed being escorted out by the security guards because they were wearing a mask. They did not escort out the whites that were going in the store, but these men, because they were large and they were African-American and they were wearing a mask, somehow were perceived as being more dangerous and more suspicious, and therefore walked out of the store and not treated equally, even though we were encouraging all people to wear masks. And then the behavior thing I talked about earlier, not really clearly understanding the benefits of tests or what the results mean. The stigma. Early on, there was a thought that African Americans couldn't get COVID, but as it became clearer and clearer that African Americans were disproportionately impacted, as well as Latinx and even some Asians in some communities, there became a fear of stigma because nobody wanted to have what was beginning to be perceived in the community as the Black disease. Because if you had COVID, then you may not go to work. If your family member had COVID, you may not be accepted back into the workplace. And so very much a fear of discovery, which often happens, plus a fundamental lack in the system. There were a lot of flyers around telling people, don't get tested, because remember the Tuskegee experiment on African Americans. So don't get tested. If you go get tested, what they're gonna do is they're gonna grab your genetics and they're gonna put it in the database and they're gonna profile you. So people with ulterior motives began to put out disinformation and misinformation in the African American communities, Latinx communities, and other communities of color to try to dissuade people from getting tested as a way of just creating enormous mischief in communities. And then vaccination, this was amazing. This was the first person to get vaccinated. She's African American, she's a nurse. It's really wonderful. But the challenge that we have is that we know that African Americans are being vaccinated at far lower rates And this is just a news story that I got quoted in, where they didn't notify all the staff equally to get vaccinated. The healthcare staff knew about it, but many of the maintenance staff did not know about it because they didn't have access to email. It wasn't shared by some of their supervisors, and people just didn't think about it. And so they didn't get it. This was a structural issue for getting vaccination. And we now know there's an enormous difference in getting vaccinated for COVID in our country. I want to share with you the other impacts of this. This is a riot that occurred in 1951 called the Cicero Housing Race Riot. I was born in 1952. I'm from Chicago. Cicero is a suburb of Chicago. And then in this situation, a Mrs. DeRose, who owned an apartment building on 61st Street, on 6439 West 19th Street in Cicero, Illinois. And she rented to a Black family. And the Black family showed up to move into the apartment and were stopped by the police, who wouldn't let them move in. And in fact, the individual was attacked and threatened by the police and was told they would kill him. And so they didn't move in, but they got together with the NAACP, who filed a lawsuit, and eventually they did move into the home. When they moved into the apartment, word was passed around that they would, quote unquote, be fun at the apartment. And over 4,000 people, mostly white, showed up at this apartment. And the family, it was a husband, wife, and 2 kids, left the building. The building was attacked, it was firebombed, their apartment was trashed. And it's important to know that there were about 21 people totally in this apartment building. There were other apartments, of course. And so the building was basically trashed. The fire department showed up. It's not clear how much they attempted to try to put the fire out, but we know the mob would not let them put the fire out. This was a big deal. It was one of the first riots which was shown on TV. And it became a big deal. Note that the rioters were not indicted. None of the rioters were indicted for this. However, the clerks, the state's attorney went to the grand jury and indicted both the renter of the apartment, his lawyer, his real estate agent, and I believe one other person. And the person that was the renter of the apartment, and they were charged with inciting a riot and conspiracy to damage property. Now, after widespread television criticism, the charges were dropped. I bring this story up because one of the lawyers involved was, of course, the young Thurgood Marshall. Was involved as one of the lawyers who defended these folks. And this is personal to me because the real estate agent was my uncle. And this is a big deal. So this is to see what happens when you get violence in the community. To give you the idea of the health impacts of this, and this, I only have a couple more slides, but this is Del Mar Boulevard in St. Louis. You can see not only do you have huge differences in housing across a street, and every community in the country has a main street or the railroad tracks. We talk about it being on the other side of the railroad tracks. Every community has these kinds of disparities. And what you can see there is huge differences in the health outcomes because the Blacks are much more likely to have heart disease or cancer in the lower income communities. It's not just the economic differentiation in these two communities. So this is one of the houses that I grew up with. This is the house that I went through for upper grade center and high school and college. I point out to this is my family home in Chicago. And one of the things that happened when my dad died was I actually finally got a chance to look at the deed of our home. And while this is not the language on the back of our deed, but there was language very similar to this in the picture on the left, which basically said they could not sell this home to African Americans. And this is an example of restrictive covenants that you would see in many racial contracts, in many housing contracts, which would clearly say you could not sell this place to individuals who are colored, who are not of the white race of the day. And I would encourage each and every one of you who's owned a home, who's had their home for a while, go back and, in particular if it's an older home, go pull the deed and see if this language is on it, because a lot of people don't realize it's on the deeds even today, particularly for older properties. And with that, I'll thank you.
Right now, we're just gonna dig in a little bit from what we heard presented, and both very excellent speakers and brilliant use of examples and current day stats. So one of the questions that Judith and our steering committee came up with for our speakers, and I know Jeremy, you're part of the participants, so please, if you can answer as well. I'm going to start with one of the current questions at the bottom, which is if with the COVID-19 pandemic, you talked about how you showed examples about the exacerbation of inequities. How does this specifically impact children and their education? And can you share a little bit more about how it impacts the children and their, I know you touched on it, Dr. Benjamin, but if you could just share a little bit more about that.
Sure. So the other challenge we have that's structural is quite interesting is that we don't have equal access to broadband in all of our communities. And it's a particular issue in rural communities, but also in some urban settings. And broadband was a problem. So when kids were sent home, they couldn't do their homework because they weren't able to get on broadband, but also the differentiation between those communities that had a computer and those children that didn't have a computer. Now, many even low-income individuals have cell phones, but cell phones are a big deal. It's a big difference. And also, when you have a cell phone and using your cell phone, you have to deal with your minutes. So there's always a cost issue. So cost, access to broadband, and then having the right technology for you able to do your homework. There are situations where we have children around the country that ride on the bus. And they ride on the bus because they can figure out the hot zones to do their homework, or they'll hang out in front of a McDonald's or a restaurant in order to try to use the hot zones there in order to be able to do their homework. So we have huge inequities, and COVID, by sending these kids home, in many cases unprepared, was a big issue around differentiating their ability to get school. And then you add on the fact that if you live in a smaller home, your ability to isolate or quarantine away from the rest of your family member who's infected is limited, if you can do it at all. And we're seeing right now huge outbreaks within family clusters at home, because many of these low-income workers, of course, have to go out to work, and they're much more likely to get infected when they go out, and then when they come home, they bring it home to their family.
Well, thank you for that. And I have a question also for Michelle, if you don't mind. When you discussed housing, you talked about One Fairfax with respect to integrating the voice of the community and finding solutions. Can you tell us a little bit more about that?
Yes, One Fairfax is a pledge or a commitment by Fairfax County government to look at equitable policies in all of their programs, in all of their procedures, in everything that they do. And the county adopted this in 2017. We know that county staff have been working on this and training in it. We know that One Fairfax pledges have been brought to the school system to look at inequities in the school system. And I know that these discussions have also been held around police reform. This is ongoing work. And I think the next area where this pledge or these policies need to come forward is in the area of development, of housing, of land use, and asking the question, do these policies advantage or disadvantage a group? Who is impacted by these decisions that are made with regard to more housing that is affordable, or the location of housing, or as Dr. Benjamin talked about, the access to healthy communities, to recreational facilities, to transit, to allow you to get to the places that you need to get to. So.
Oh, thank you for that. And just a couple more questions. Oops, sorry about that. I have too many things up on my screen here. So we talked about the Fair Housing Act of 1968 that was supposed to promote equitable access to housing by ensuring that access would be based on the individual's financial resources. Now, I know you touched on this as well. In what ways did it fail? And what does housing, and why does housing remain so segregated?
Ozzy, I have an example of that. If you don't mind.
Yeah, so for those of you that don't know, Jeremy was supposed to be one of our panelists who works on the more local level. And you can just introduce yourself and answer the question if you wanted to.
Thanks, Fazia. Yeah, this is Jeremy 𝐏𝐫𝐞𝐬𝐞𝐬, former organizer for Voice in Arlington and Alexandria. I'm currently the founder of a more tenant-based organizing effort, Tenants and Allies Network, which is going to be launching in April. Thanks for having me, and thanks for Fazia and others for putting up with me over the last 3 weeks. I've had a bit of a family issue where I've been basically MIA for a while. So one way, at least from the Fair Housing Act, that it failed, I'll use Alexandria as an example, where in a historic African-American community, the Burg, goes straight to Old Town. Fair Housing Act, the funds from that were used in order to, through eminent domain, buy property of formerly African-American owned households and neighborhoods, and then replaced with public housing. And what that does longer term, it plays the longer term equity of people being able to build wealth through property ownership. So one of the residents I work with, Daryl, who lives at Andrew Adkins, which is near the Braddock Road Metro Station. He's like, I remember when this was free market. It was a market-based community. This is where I grew up. They took the market away, and now they're replacing that, the public housing, with some public housing and the rest also market rate. That's no longer affordable for people that live there because they weren't able to create longer term equity, wealth development over 50 years of ownership. Fazia, I can't hear you. I'm not sure if people can hear me.
I'm sorry. Yes. Thank you for jumping in there. Michelle, did you want to add anything else, or Dr. Benjamin? Because I have one last question and then I think we're going to go to breakouts. Okay.
I think Jeremy is right. There's this pattern of pushing Black residents into redlined communities. And then we saw through urban renewal, destroying those communities, of moving Black residents around. So there's just a fundamental disrespect for these communities and their neighborhoods and the relationships they have. And it's just this process. And why it happens, I think, is because the powers that be have been able to use laws to circumvent the intent of fair housing. Now, more people are fighting against that now.
Well, thank you for that, everyone. And Jeremy, thanks for adding the local issues. And okay, so at this point, I have a final question. It came up in an earlier webinar that I was doing, and we asked a panelist, which I think is appropriate here, and if you could just do in a sentence, in 2021, in your presentation, what would be the one thing you would like to see worked on in priority-wise from your presentation? What would you like to see happen?
Yeah, this is George. I think there's lots of ways in which we can use zoning and in more proactive ways. So for example, reducing liquor store density in communities would be an excellent example, because we know that it correlates very highly with alcoholism and its surrogate mental illness. Making sure that we zone communities so that we can make sure that there's access to affordable foods in all communities. I did a sabbatical in New York, and I was always amazed at where I was staying in the area of the 1%. There were no fast food places there. But when I went into the hood, there were, in my lower income communities, lots of fast food places, but not very many grocery stores.
Yeah, no, thank you for that. Anyone else would like to share their perspective for 2021? What would be a priority in our discussion today?
I think investing in low-income communities, there's a lot of discussion about creating opportunities for families to move to neighborhoods of opportunity. So to leave where they are and to go to neighborhoods of opportunity. There's a real desire among these communities to retain their community, their relationships with their neighbors and with the businesses. So investing and providing some of the things that Dr. Benjamin talked about, the nutritious foods, the affordability, the opportunity, better schools. I think that's where we need to be. Rather than, again, moving people around, we need to invest in where they are.
And Jeremy, any words? Like, I know you were working on evictions. Thank you, Michelle.
Yeah, so I think there's a lot of very particular specific issues that need to be addressed in 2021, but I think the underlying larger issue is just that there needs to be more representation of people from different backgrounds, whether that's race, gender, economic background, right? We talk about systemic racism, systemic problems. The reason why it keeps perpetuating is because our country was founded only by people with 5 characteristics, right? You're a straight, white, Christian, landowning man. And what we're trying to do through everything we're doing is sort of break that down and change it so you don't have to have all 5 of those characteristics to become what we want in our society. So unless you have other people at that table making the decision, it doesn't change. And we see that pretty consistently. So I think no matter what our issue is, that's the goal.
I think we have our work cut out for us, guys. At this point, I'm going to turn it over to Judith to talk about our breakout sessions at this time. Judith? Thank you, everyone. That was brilliant.
Thanks, Fazia, and thank you to all of our speakers. We're going to move into our breakout sessions now. We are running behind time from our schedule, but our expectation is to give 20 minutes to these breakout discussions and then bring everyone back into the full group and get some reports out. So let me, I'm just going to share my screen for a minute. I hope you can see that. In this discussion, what we're asking you to do is think about how do the inequities in housing and health impact you. So there might be something that that you or someone you know actually experienced directly. Or you might be aware of some changes in your community that had an effect on you. And think about why would it make life better for you and your family if those inequities were eliminated. So we're really looking to get you to think in a very personal way about this very significant problem. We've created groups of about 6 to 8 participants. Each of them has a facilitator that's been assigned ahead of time. That facilitator will ask one of the people in the group to serve as a reporter. The reporter is asked just to take some notes, be ready to give us a quick summary of not more than 2 minutes when we all get back together, giving some highlights of the discussion, some insights that you got out of this discussion and any questions or other issues that came up. The only other thing is to just observe the normal rules of etiquette in these kinds of conversations. You know that when all of you are in a group, you can unmute yourselves, but then allow the facilitator to designate someone to speak, so you're not all speaking one over the other. Please be observant of characteristics of open-mindedness, acceptance without judgment, curiosity, we really want to learn from one another, discovery, sincerity, speak for yourself, your own feelings, and brevity, because we really don't have a lot of time and we want to try to make sure that everyone in the group has a chance to speak. I will ask Miriam, who's working with us on the technical side of things, to in a moment just move you all into the breakout rooms. You've been pre-assigned to rooms. You will probably get a message that you need to click on that says join, and then you'll be in that room, and we'll be ending the breakouts in 20 minutes, and you'll automatically come back again to the main room so that we can hear the reports and get some final comments from our speakers.
The participants engaged in lively discussions in their breakout groups, and upon returning to the full group, began to report highlights of these discussions. Unfortunately, the first report was not captured in this recording, but the reporter, Reverend Casey, shared the following notes. The group shared stories about issues of access, especially with relation to housing. For example, a man of color who applied for a mortgage and had to provide 3 times the documentation as a white man who worked under him who was also applying for a mortgage at the same time. A Jewish participant who grew up with restrictions on access to housing and opportunities based on her religion views this as a taste of what many in our society endure. An immigrant from Brazil struggles to understand how our society works, especially in terms of race. They noted also that certain institutional associations can also be a source of privilege. The group then shared some ideas about where we go from here, given that these conversations are a jumping-off point, not an end in themselves. Through these workshops, we develop skills needed to speak and act, including in our own worshiping communities. It is critical to have people of diverse backgrounds represented at the tables of power. And finally, the report notes that while more women and people of color are running for elected office, we need to ensure that voices of those without citizenship status are also heard. Our recording continues with the report of the second breakout group.
Linda?
There, I was muted.
Okay.
Up here. Okay, I just have notes in order of the things we said. Those of us, many of us in the group had experience with structural racism in housing. Mostly we were the privileged ones who knew of other housing but didn't experience it ourselves. Excuse me, one person said that mandatory busing had been wonderful for him because he finally went to an integrated school and he experienced Black teachers for the first time and they taught him so much. There was a comment about Columbia, Maryland, an open community, but there is an admission cost. And I didn't ask what that cost was, but I guess it's financial. I didn't know that. And anyone can live there, but in fact, they have to afford to live there first. And that gets into who can afford to live in what neighborhood. Economics and structural racism are intertwined, and it's our awareness, first of all, that's crucial. And it's also the first step to kind of deconstruct the structural racism that exists, even if sometimes we don't think it does, but it does. Okay, also we talked about the International Baccalaureate Diploma Program as a way to equalize education. And that was my baby, but I worked in it for 14 years, and I think it's a great program for high school students. Anybody can take it and do the work. Okay.
Thank you for that.
Eleanor, can you add anything?
Eleanor.
Well, I think that a large part of our group were in the bubble for a long time and have found it to be very illuminating to emerge from the bubble and to have a more realistic view of, you know, what diversity can mean in terms of your personal life. A lot of us were in a situation where we didn't think about it. And this has been very illuminating.
Thank you, guys. Who would like to go next?
I can go next. Actually, Israel was in our group, and he
Just kind of say your name. And
I'm Asamini, and Israel was the reporter for our group, so he volunteered to help share our thoughts.
So our group, I think, for the most part, did not experience inequity in housing directly, although we did talk about that, and we talked about the neighborhoods and the buildings that we were in, apartment buildings, where we experienced some of that types of racism, where people could be made to feel not welcome, whether directly through personal experience or indirectly through the application process. And we also talked about immigrating to the United States and how that might affect you know, your additional feeling of being an outsider in the community that you're in, and then we also talked about being an advocate. That one of the ways that we could fight racism is to be an advocate for other people, even if you don't experience that yourself. So I think that's the
yeah, if we had more time, I would love to explore what kind of advocacy, but in the interest of time, I just want everyone to know we might go over. So please don't lose hope. We are going to finish up here in a few minutes. Who's the next group?
I'll go next, if I may, group one. We had the privilege of having somebody from the police department with us. And he says that it's very noticeable when we'll call high rent districts, they rarely ever go unless they are called. Whereas in the lower rent districts, they always had this notion of being there kind of to keep the undesirable, the criminal element under control. And they're having to really rethink how they do that and establish a sense of trust in that community, so that they're not there basically to put people down, but to work in cooperation with them. So the same thing in health. So some areas have just virtually no hospitals as we do in our area, our immediate area, and try to help people get that medical care too that is in short supply because of the residential pattern. So that's a big job of changing the conversation, having conversations with his white colleagues, trying to get them to understand their bias and how to talk about that bias. And once she said, asking questions is a better way to establish that bias and then try to work on it. One person experienced a total neighborhood flip during their lifetime and discovered that there was great intentionality about having done that, largely through redlining, and that organization, that offices that should not be involved in that were actually involved in that negative work. We agreed that a lot of us would like to live in more integrated housing. When it happens, it's transformative, and but the prices often make the makes a difference between whether you're having integrated housing or not. So there. I covered it.
Nope, you're good. Thank you so much. Is there, how many groups do we have? Do we have another group? That was 3 groups. We have more. Who wants to go next? Just jump right in.
Okay, well, I'm the reporter for Fatima's group.
Thank you,
And we also had many of the same kinds of things that we saw that those of us who are privileged by the virtue of our white skin were less aware and have over the last few years become more aware and feel very I guess pleased that we can engage in this kind of conversation and do more to impact our neighbors of color. And one of the things that we've talked about, one of the things that was shared was that it's often subtle, and the discrimination against is often subtle, and one of the people in our group felt that their neighborhood was watching her neighborhood become more and more integrated, and she thought that was great. And then we also shared some ideas about immigration as well, that it was, from the outside looking in, people were not aware that this is such an explosive and long-standing problem in America, and yet growing up here as part of an immigrant family, one of the people shared that they said that they took on affectations and that their family members made fun of them using their white voice, if you will, when she talked to a customer service person. And so I think that just an understanding of how and what we need to do, and some of it's very sad to have to counsel your family to dress a certain way or to behave a certain way to be treated equally.
Well, sounds like you guys had a good discussion, Melinda. Thank you for reporting that out. And I think we have 2 more groups before we make any final comments.
I'll volunteer my reporter, Mira Beth.
Okay. I think we touched on some of the same things that have been discussed. We had 2 members who had parents who came here after the Holocaust and initially had housing restrictions, but that has changed over time. I think also, I guess one thing that really, we also had somebody who's in the military and who pointed out that as they, as this person will get transferred, she says a lot of the housing around bases is not where there's the best education for your children, not near places where she would want to go worship. And so, that's something, we all really want people to be able to live where they are comfortable and where they want to live. But I guess something else that really struck me that Dr. Benjamin said, and that is, do we really value diversity? And do we value it and recognize all of the richness and advantages that it brings to us? Anyway, that's all.
Well, that was very powerful, Mara, that to end in Dr. B's comment or the question, do we value diversity? And you could see if we start listening to each other, a lot of repetitive housing discrimination and inequities. I think we have one more group who would like to report out for the final group. Do we have one more group? Or that's it? 5 groups? Yeah. Okay. Great, thank you everyone for that. And at this point, we are still going over by a few minutes. And we had some questions from the audience. Judith, I'm gonna take some direction from you at this point. We also, at this point, would like to hear some final remarks from our panelists. Judith, how much time do we have for questions?
Well, I think it depends upon how long people feel comfortable staying, since we are past our end time. I think many of the questions were addressed, at least in part. We can bring them up if there's time, but maybe it would be better to ask our speakers, or it might just be Georges. I think that Michelle had to leave us. But if,
okay.
At least I don't see her at the moment, but maybe we could ask Georges for any responses to some of the things that we just heard, and
Okay.
any other sort of concluding remarks that he'd like to share with us.
And-
I know
and
people have been
Georges,
asking also about what things can we do to address these issues, and I hope we'll address that in our final workshop, but maybe Georges has some suggestions on that too.
Sure. Let me just say, we always want to value diversity, because diversity, the business community has learned very clearly that life experiences bring value to an organization, so you don't get into groupthink, that you don't all think you have the same experiences, and that's very important. But I also think that it's very important that we realize that racism and discrimination still exists. It exists for people who are overweight. It exists for people who have disabilities. It exists for people for whom physically are different, or people who have different accents. You know, people bring their biases to those individuals to the table. And, you know, I would like to say that I would like to believe that I'm an accomplished person. I've got an MD. I've had a reasonable career in health. When I'm up and about and out, I generally am wearing a suit, and I drive a nice little Honda CRV. It's not a fancy car, but it's a nice little car. And yet, I get profiled. You know, if a police officer stops me, I do fear, well, whether I'm going to get shot or not. If I am walking down the street at night, now I grew up in Chicago. I'm not worried about the thugs jumping all over me, but I am worried about the police. I do have to be more thoughtful about that. I had 2 daughters, and there was a time when I wasn't worried about my daughters, but I do worry, you know, I have 2 grandsons and a granddaughter, and I worry about my 2 grandsons. And, you know, I just think that one of the things we have to think about is that we have to recognize that everybody's had different life experiences. And I think it's more important for all of us to be more listening than speaking. And if we can listen to one another and really understand where people are coming from and why they said what they said and why they did what they did, you may not agree with it, but at least if you listen and understand from where they're coming from, I think we'd be much more likely to achieve racial harmony and peace and prosperity for all of us. With that, I'll stop.
Thank you, Benjamin. Thank you for staying on. I know we're going over. These are excellent points, and I can't say any more to you know, what you just said about racism will exist for different reasons. And tonight I saw hope when ICD continues to open the space, and we have people in our groups that are saying, this is my first time, you know, coming to a space like this. So that tells me that it might be a slow process, but I think we're working on it. And the other hope is integration. I love that word, integration. I don't know if Jeremy or Dr. B, you can answer this, but if Michelle is no longer here, but when you talk about integration, I've heard this conversation before. You go back to the 60s, and you know this more than I do, that we have tried integration and there was reverse integration. So what can we do that's different this time? What can we do different?
Do it better. Yeah, I mean, so I think the big thing, and I'm gonna beat this dead horse, so I apologize in advance. It has to do with not just integrating schools. It's making sure that the way our society is set up and functions, that it allows integration on all fronts, right? So I shared in my group earlier, where I have an Irish Catholic last name. I'm Jewish. I went to majority minority school. And my best friend's a Muslim Pakistani kid still to this day. Like, that happens, which means that no one's ever going to be able to convince me that we should have a Muslim registry or something like that, because I've seen what that looks like. I know what people are. I think what a lot of this comes down to is also making sure it goes from not just words, but to action. And where that comes from for someone, at least where I view it, is that we have to make sure that our local counties, our states, and even our personal budgets are moral documents, right? So if this is something that we value as a community, we can't just stay with equity statements or anti-racism statements coming. We have to make sure that we are putting funding in, and we are making sure that it is fitting in to the policies that we are passing, so that we're able to break down some of the systemic and structural racism. Because redlining was legal, right? Everything that we're talking about, all the sins of our past, they were legal. So for us to be able to make up for this is, how are we going to address things moving forward? And I think that's the best way.
Thank you. Judith?
How
are we doing? I can't hear you.
We're doing fine. I'm not sure whether you would just ask me a question or.
Yeah, I'm just, I heard from Jeremy in closing. Would you want me, Doctor, to do a closing remark at this time, or Pammy? How do you want to?
I think I want Dr. Benjamin and Jeremy to say whatever closing remarks they want.
Okay. So at this point, we'll go to closing remarks from our
Can we do questions?
I
have a question.
Okay, go ahead.
Okay, shoot.
I guess this was for Jeremy, Benjamin. My question is this: before policies are formed, it seems there needs to be sentiment or empathy at a basic level before you form policy. How do we generate the empathy that precedes the policy efforts?
Well, that's a good question. I think that trying to have a kumbaya moment before we decide to do something is always very difficult. I think so I don't know how well you do that on the front end. I can't make anybody like me, but I do think that what we can do is we can look at it on the back end for sure. In other words, we can get the data, we can get the information, but far too often we don't even get the data or information. We pretend like the information isn't there, and it's usually quite visible. This is, first of all, segregation is usually not a secret. You can usually walk down or drive down the street and look left and see one community and look right and see the other. And then what you have to fundamentally ask yourself is, why is it that way? And we get the communities because they were designed to be that way. And I think that's the point. These communities did not happen by accident. They were designed to be that way. Someone did it for a purpose. It may have been an economic purpose. It may have been with just all about money, not about racism or discrimination. It all about money. It may have been about racism and discrimination. It used to be. But I think the question is, when you see something that is the way it is and you want to change it, then you ought to get the data, you got to look at the history, understand how it got that way. And then if you want to change it, then through policies or definitive acts, you can make the change. We bust kids into African-American kids in the white communities, and the white communities went to private schools in order to avoid those African-American kids. And so, in some ways you would like to think that we could design these communities differently. But a lot of the reasons those kids left those communities because they were the families left, but they were afraid of being around those African-American kids. They were afraid somehow those kids would not do as well. As I was saying in my breakout room, is that we were the second African-American family in our neighborhood. It wasn't that there was lots of for sale signs in the neighborhood, but we were the second one. And 5 or 6 years later, there weren't very many white families in the community. And I remember the last white family on my block. I played with this kid. He's a very good friend of mine. His mom and my mom were very, very close. And this woman was determined she was not going to move. This was her house. She loved that neighborhood and she stayed there until she died. But many, many other people got up and left. I can't explain why they left, but it's interesting that they left when I moved in.
If I might, I have a follow-up to that. So you were talking before about being in your neighborhood and being in proximity. One of the things that I found when I was in Israel, we had this thing where we had our schools. We went to a Palestinian school. It was actually a getaway for about 3 or 4 days. And we had that interaction just by being in proximity to each other. So I'm wondering whether in some ways, in order to generate empathy, whether it's simply a matter of bringing people together that normally don't get to see each other on a regular basis. Just being in proximity could generate that kind of empathy.
Everything comes from relationships, right? What sports team you cheer for comes from the proximity or someone in your family, or maybe like colors, right? Like everything in your life has to do with the relationships you have. I always think that as someone who grew up white, working class, the only difference between myself and Steve Bannon is that I'm Jewish and that I grew up with people who didn't look like me in my neighborhood. But that's the bottom line. So I think the big thing is, one, making sure that particularly people who have inherent power go out of your way to make relationships with people that don't come from the same background as you. Mm-hmm. I think that's the first thing. So conversations like this, that's incredibly important. I think the second, and this is something that I think a lot of organizations struggle with, is that we put directly impacted people in the position to speak for or be like the mayor of, the running joke of from the 90s of Jesse Jackson being the mayor of all Black people. We can't do that. When someone has more power in the conversation, we cannot just put somebody up and say, hey, speak for your entire culture, speak for your entire race. It's about making sure that you have, that the person who has the inherent power is exposing themselves as the first one that is being open towards forming that relationship. We cannot expect it to all come from the people that have been less privileged, if that makes sense.
I couldn't have said that better. So we've heard from the panelists, and Israel, thank you for your questions at the end there. Are there any final remarks from the panelists at this time before I turn it over to Pammy and Julie?
I just have a question. If I saw an article prior to the inauguration about all the bridges being closed and that the impact of the healthcare in disadvantaged neighborhoods was proportionately more horrific, because if something would have happened, people from those neighborhoods wouldn't have had any access to hospitals. And that was just a 1-day thing or a 2-day thing. So my question is, how often does that kind of thing happen sort of categorically across the board without any policy? It's not a policy, it's just that because those neighborhoods already exist and are disadvantaged by the fact that there's no hospital in direct access and you have to cross a bridge to get to one.
Let me correct one thing.
Sure.
It is a policy. It's policy because they didn't think about it. They didn't say, how do we get the people in Ward 7 and 8 healthcare
right
faster? And I think that's the point. You have to ask yourself, if I'm going to do something, who am I going to disadvantage by doing it this way? And then how can I mitigate that? We got to have the security, but there's only one hospital in Ward 8. it isn't that big. And I'm not sure there were contingency plans to get people out of Ward 7 and 8 into Maryland hospitals or Virginia hospitals. There may have been, I'm not aware of it.
Right. Well, I know that it happened quickly, and that's what I'm talking about is, yeah, contingency plans and the fact that maybe they didn't think about that.
Yeah, but you know, we've been doing this since what, 1700s.
Mm-hmm.
You know, as long as we've been having inaugurations at least.
Right.
And when I was a health commissioner in DC, I know that those kinds of plans were not as thought through as they needed to be, because I was part of some of the contingency planning then.
So,
Thank you.
yeah, thank you for that. And thank you for your question, Melinda. So at this point, it's time to order some pizza. But I think what we're going to do here is remind everyone before I give it off to Judith and Pammy, is to let you know that if you felt enlightened or awakened by these ICD webinars, please join us for our final 4th series coming to you soon. Stay tuned. And at this point, thank you for coming and staying on. I'm going to now turn it over to Judith and Pammy. Thank you so much.
Thank you.
Thanks, Fazia. I will do this very quickly. I know that everyone has stayed late, and I think that just is a tribute to how interesting and valuable this discussion has been. As Fazia indicated, we do have one more workshop in this series, which will be on March 7th. In that workshop, our primary focus will really be on some of the things the question that's been raised numerous times in these 3 sessions we've done so far is, what do we do about all of this? So we really want to try to bring more of a focus to, you know, we've been awakened and informed about issues that we really care about. How can we make a change? So I hope that people will join us. You will be receiving email from us both about a survey that we would love to have you respond to. It will also include information about registering for that March 7th workshop, and a list of some additional resources that you might find really interesting and helpful to get more information about these issues. So, so you should be hearing from us within the next few days. And for my part, I really just want to say thank you to everyone that participated, took a role in this, and especially to our speakers. So I'll give this over to Pammy to do our close.
Thank you, Judith.
Thank you, Judith and Fazia. My thanks are primarily first to the speakers. I think Dr. Benjamin, Michelle Krocker, and Jeremy, I think you've done a wonderful job to help us understand systemic racism and get into some depth. Most of our conversations tend not to have that expertise that you bring and the experience that you bring. So it is wonderful to have you here. Thank you so much. We hope we'll keep in touch with you and you will continue to follow what we are doing. Second, I want to thank this working group that has planned this workshop and the previous ones. My name is Fazia Deen, Judith Shamir, Eleanor Saslow, Manjeet Singh Taneja, Melinda Roth, Fatima Popal, and Miriam Chatib. And this is the group that has been working for the last many months. And I think they're planning a wonderful workshop on the 7th. So we invite you to join us again. So thanks very much to all the participants, especially to the speakers and to the reporters and the facilitators. And we hope to see you in a month's time.
And a shout out to Asamini too. Thank you.
Asamini, thank you.
This has been a workshop on systemic racism in health and housing. It was the 3rd in a 4-part series presented by the Interfaith Communities for Dialogue. Session 4 on March 7th, 2021 will focus on how we use what we have learned to build bridges for racial equity. To view other workshop videos in this series, click on the playlist button below. To subscribe to our channel and receive notifications of new videos, click on the subscribe button below.